In 2007, a man boarded 3 international flights while infected with a drug-resistant strain of tuberculosis so dangerous that when the CDC finally caught up with him, they invoked a federal isolation order that hadn't been used in over 40 years. He wasn't arrested for a crime, he was arrested for breathing near people. That's the part nobody tells you about quarantine. It was never really about you. Welcome to Catastrophe Theory, where we figure out exactly how fast your life falls apart if you actually let the intrusive thoughts win. I'm CJ Theory, and today we're looking at what happens when you climb out the back window of a quarantine facility at 2 a.m. because some primal part of your brain has decided that 4 walls and a wristband are worse than whatever's floating around in your bloodstream. Picture this. You're in a room that used to be a hotel room. You can tell because there's still a Do Not Disturb hanger on a hook by the door, except now there's a second sign taped underneath it, laminated, official, stapled at a slightly crooked angle like whoever hung it up was in a hurry. It says, "Isolation, authorized personnel only." The air conditioning hums at a frequency you didn't notice for the first 6 hours, and now it's the only sound in the world. Somewhere down the hall, a cart squeaks past twice a day. Breakfast, dinner, food left outside your door like you're a dog being fed through a fence. You haven't touched another human being in 9 days. You haven't touched a doorknob that wasn't yours in 9 days. And you are, by every legal definition that matters, not under arrest. Nobody has read you your rights. There's no judge, no jury, no trial. And yet, there is a security guard sitting in a folding chair at the end of the hallway, and he is not there for decoration. This is the paradox that quarantine has always forced on the human animal. You have committed no crime, and yet you are, unmistakably, not free. Your body has become a variable in an equation that affects strangers you will never meet. And somewhere around day 9, day 10, day 11, your brain starts doing the math differently than the CDC does. What if I just left? It's not a criminal thought, it's a claustrophobic one. It's the same part of your brain that makes you want to unbuckle your seatbelt on a turbulent flight, not because you think it will help, but because doing something feels better than doing nothing while trapped. I've spent the last few months talking to public health attorneys, epidemiologists, and this one surprised even me, a man who actually did climb out of a quarantine facility in 2014 during an outbreak most Americans have functionally forgotten about. He didn't want his name used, he wanted his story used, so that's what we're doing. Because here's the shocking part, and we'll come back to it. The legal consequences of walking out of quarantine are, in most of the developed world, dramatically worse than most people assume, and dramatically more inconsistent than any government wants to admit. Let's take it apart. Here's the first thing almost nobody understands about quarantine enforcement. It usually doesn't come from the police. It comes from public health authority, which is a completely different legal animal and one that predates modern policing by centuries. Think of it like this. Your local police department enforces the criminal code, theft, assault, trespassing, but public health departments in the United States, the UK, Canada, Australia, and most of the world operate under something older and, frankly, stranger. Police powers reserved specifically for the protection of public health, dating back to plague-era maritime law. The word quarantine itself comes from the Venetian 40 giorni, 40 days, the period ships were held offshore in the 1300s before docking, the defense against the Black Death that predates germ theory by 500 years. Nobody knew why it worked, they just knew that when they did it, fewer people died, and when they didn't, entire cities did. That history matters because it explains why quarantine law feels so unlike normal law. It wasn't built around punishing bad behavior. It was built around a mathematical reality. Disease doesn't care about your intentions. It doesn't matter if you feel fine. It doesn't matter if you're pretty sure you're not contagious anymore. The system was never designed to evaluate your character. It was designed to evaluate your body as a vector. So when you climb out that window, you're not evading a cop, you're evading a legal structure that treats your location moment to moment as a piece of epidemiological data. And that data doesn't vanish because you're no longer supervised, it just becomes unknown, which to an epidemiologist is worse than bad news. Bad news you can plan around. Unknown data means every subsequent model has to assume the worst-case spread pattern because nobody can rule it out. Let's get concrete, because vague fear is not useful, precise fear is. In most jurisdictions, quarantine orders are logged the moment they're issued, meaning your name, your last known location, and your medical status are already sitting in a database before you've even decided to leave. When a facility discovers you're gone, and this usually happens within one shift change, so realistically 4 to 12 hours, the first call isn't to the police, it's to the state or county health department's legal counsel. Why? Because in the U.S., breaking an isolation order can trigger a completely separate legal track from ordinary crime, a civil contempt proceeding, which allows a judge to issue a warrant for your involuntary return to custody, not because you're a criminal, but because you're now considered a public health risk that a court has the authority to physically compel back into containment. This is one of the only areas of American law where a person can be detained without having committed a criminal act, and the legal justification traces back to a 1905 Supreme Court case, Jacobson versus Massachusetts, which upheld a state's right to enforce mandatory public health measures over individual objection. That's the sobering part. The legal machinery that would come looking for you is old, it's tested. It's been in American law longer than the automobile. Here's where it gets genuinely unsettling and where most people's assumptions collapse entirely. You might imagine that if you slip away from quarantine, you become a fugitive in the traditional sense, a wanted poster, a description, a BOLO. In reality, health departments in high-risk cases can escalate almost immediately to something with far more reach. Coordination with the CDC's Division of Global Migration and Quarantine, which maintains what's sometimes informally called the Do Not Board list, the same mechanism used for known infectious threats at airports. If your case involves a disease with pandemic potential, your name can be flagged at every port of entry and airline check-in counter in the country within hours, not days. This is precisely what happened in that 2007 tuberculosis case I mentioned at the top. Andrew Speaker, the patient in question, wasn't hunted down through a dramatic chase. He was flagged the moment he tried to re-enter the United States, and border agents were alerted before his flight even landed. He was intercepted, isolated at a federal facility in Atlanta, and became the first person in 44 years, since 1963, subject to a federal isolation order, because his case crossed international borders and exceeded any single state's jurisdiction. Why does that distinction matter? Because it changes who's allowed to come looking for you and how far their authority reaches. Here's the piece that tends to get lost entirely in the legal conversation, and it's the piece I think matters most. While you're busy outrunning a health department, your immune system has no idea any of this is happening. If you left because you felt fine, it's worth understanding what fine actually means during an incubation period. Depending on the pathogen, you can be contagious for days before symptoms appear. This is called the pre-symptomatic infectious window, and it's precisely why quarantine exists in the first place. Isolation is for people who are already sick and confirmed positive. Quarantine is for people who were exposed and might become sick, silently, while feeling completely normal. Your body isn't lying to you when it tells you that you feel okay. It's just that feeling okay was never the metric anyone was measuring. Think of your immune system as a security guard doing rounds in a building at night, methodical, checking one hallway at a time. A pathogen replicating in your body is like an intruder who's already inside, moving quietly before any alarm goes off. By the time you feel something is wrong, the intruder's already been in the building for hours, sometimes days. Escaping quarantine because you feel healthy is trusting a guard who hasn't finished his rounds yet. So if the system is this old, this coordinated, and your own body is working against you the whole time, why do people still try? And more importantly, what did they get wrong about the risk? Let's clear up the myths. Myth 1. It's just a fine, like a parking ticket. Reality, in many jurisdictions, violating a quarantine order isn't a civil infraction, it's a criminal misdemeanor, and in cases involving a serious communicable disease, it can be elevated to a felony. The parking ticket assumption comes from confusing quarantine with something like a curfew violation. But a parking ticket doesn't involve the theoretical risk of transmitting a disease to dozens or hundreds of people. Courts have historically treated quarantine violations with a severity that reflects aggregate risk, not individual intent. Myth 2. If I feel fine, I'm probably not contagious anymore. Reality, contagiousness, and symptom severity are frequently disconnected. Quarantine periods are set using population-level data on viral shedding and incubation windows, gathered from thousands of documented cases, not from any single person's subjective experience. Your body's feedback isn't unreliable because you're careless. It's unreliable because feeling fine was never the metric epidemiologists were measuring. Myth 3. They can't actually force me back if I've already left. Reality, in documented cases, health departments have obtained court orders authorizing law enforcement to physically return individuals to quarantine or isolation facilities under judicial authority upheld repeatedly since the early 20th century. People assume freedom of movement is an absolute right that overrides public health authority. But courts have consistently ruled that individual liberty can be constitutionally limited when there's a demonstrable, science-backed risk to public safety. Myth 4. Nobody will actually come looking for one person. Reality, contact tracing infrastructure means that a single missing quarantine case can trigger disproportionate resource allocation, not because you personally are considered dangerous, but because your unknown location represents an unquantifiable variable in a transmission model that public health officials are legally and professionally obligated to close. So if breaking quarantine is riskier, more coordinated, and more consequential than almost anyone assumes, what do you actually do if you're the one sitting in that room, staring at the window? This is the part where fear becomes something useful. If you ever find yourself under a mandatory quarantine or isolation order, here's the framework that actually protects you, legally and medically, better than any window ever could. Read the actual order, not the summary you were given verbally. Quarantine orders are legal documents. They specify duration, conditions, and critically, your rights of appeal. Identify who has legal authority over your specific order. Is it a state health department, a federal one, a hospital acting under delegated authority? Your appeal process depends on who issued the order. Request a reevaluation, not an exception. You generally cannot argue your way out of quarantine by saying you feel fine, but you can request retesting, which may shorten your isolation period based on updated medical evidence. Document everything: symptoms, dates, communications. If your case ever needs review, a clear timeline protects you. Use official channels for mental health support, not isolation-driven decision-making. Almost every documented escape case involves someone who reached a psychological breaking point, not someone calmly calculating risk. If you believe the quarantine is unjustified, use legal appeal, not physical departure. In many places, you can petition for judicial review. That's the legal version of escaping, and it's dramatically more effective than climbing out a window. Keep a support contact updated on your status every day. Isolation makes everything feel more permanent than it is. A single daily check-in can make an enormous difference. Understand your release criteria before you go in, not after. Ask what test result, what date, or what clinical marker ends the quarantine. Uncertainty is what makes quarantine feel endless. That's the actual survival kit, not a window latch, a phone number for legal aid, and the patience to use it. Here's what I want to leave you with, and I want to say this slowly because it's the part that actually matters. Quarantine feels to the person inside it like punishment. It isn't. It's one of the oldest, quietest acts of collective trust our species has ever engineered. A system built on the premise that a stranger, someone you'll never meet, is worth your temporary discomfort. It's not a cage, it's a favor extended forward in time to people who don't even know your name. That doesn't make the fear irrational. Being confined against one of our most basic instincts, movement, autonomy, the simple right to walk outside, is one of the most psychologically taxing experiences a healthy mind can go through. The Diamond Princess quarantine demonstrated that for many people, the confinement itself was the hardest part to endure. But here's the reframe. The same legal machinery that feels so suffocating in that room is the same machinery that, historically, has kept outbreaks from becoming catastrophes. Every 40-day maritime quarantine in the 1300s that felt like a death sentence to the sailor experiencing it was, statistically, one of the most effective public health interventions in human history, centuries before anyone understood why it worked. You are not trapped in a broken system. You are, briefly, one small moving part in one of humanity's oldest working machines for protecting itself. So if you ever find yourself in that room staring at a window that isn't locked, remember, the door out was never the window. It was the phone call, the appeal, the documentation, the daily check-in, the boring, patient, unglamorous paperwork of trusting a system that, for all its flaws, was built by people trying to protect ordinary life. The dinners with people you love, the mornings you don't have to think about any of this at all. Stay prepared, not paranoid. Read the order, know your rights, and let the boring stuff protect the beautiful stuff. But that's just a theory, a catastrophe theory. Thanks for not ruining your life.